Hello everyone, myself Pragati Khalane. My topic is drug dosage form local. I am the second year MBBS student at the college Dr. Ullas Patil Medical College and Hospital. Drug. Drug is an agent used for the diagnosis, mitigation, treatment, cure or prevention of the disease in humans and animals. Dosage forms means though which drugs are delivered in the body towards its site of action. They are the final products containing drugs that is administered to the patient. Dosage forms includes active drugs and pharmaceutical excipients. Classification of dosage form according to the route of administration include the oral, topical, ophthalmic, parenteral, inhalation, optic, rectal and vaginal. So first is local drugs include the creams. Creams are semi-solid dosage forms that are mixtures of oil and water used for the topical administration. There are two types of creams, oil in water and water in oil creams. Example are cold creams. You can see these are the creams. Next are the dentifrices. Dosage forms include the powder, gels or liquids that are used to clean the surface of the teeth. They contain detergent, abrasive and anticarcinogenic agents. Example close-up, Colgate, etc. Draughts. Draughts are liquid oral preparation taken as a single dose. You can see this. This is the image of the cream. Next are the dusting powders. These are the powders which are in a fine state for external application, usually to the skin. Example talc, kaolin, etc. Ear drops. These are the solutions of drug that are installed into the ears with a dropper. Example H2O2 ear drops. You can see this is the ear drop. Elixirs. These are the clear hydrochloric liquid oral preparations of potent or nauseous drugs. They are pleasantly flavored and usually attractively colored. Emulsions. These are the biphasic dispersed liquid dosage form in which two immiscible liquids are mixed with the help of emulsifying agent. The type of emulsifying agents like oil in water or water in oil, etc. These are, you can see, elixirs. Next are the enemas. An enema is a solution, suspension or oil in water emulsion of intended for rectal use. They are used for anti-inflammatory, purgative, sedative or cleaning purposes. Example sterile water enema, soap enema, etc. Ear drops are sterile saline containing drops used as a vehicle to administer medication in the eye. They are used for anti-inflammatory, pediatrics, myotic and diagnostic purpose. Eye lotions are the sterile liquid preparations intended for the application to the conjunctiva or eyelid margin. Gargles. It is aqueous solution used to prevent or treat throat infections. Usually they are dispersed in the concentrated forms with the directions of dilution with the warm water before use. Granules. Granules are prepared of small particles of powders. They are spherical in shape and vary in sizes. It contains medicament as well as other experiments. Example ENO. You can see this is the eye drops. Next includes the effacement granules. These are mixtures of citric acid and tartaric acid with sodium bicarbonate. One of more organoleptic agents are used. After addition of granules into the water, bicarbonate reacts with the acid and liberates carbon dioxide. The preparation is taken during effacement and immediately afterwards. Example ENO. Inhalations. These are the liquid preparations or containing volatile substance. These are used to relieve nasal congestion and inflammation of the respiratory tract infection. Next are the insufflations. These are medicated dusting powders that are blown by the insufflators into the regions such as nose, throat, body cavities and the ear to which it will be difficult to apply the powder directly. Next are the irrigations. These are the solutions of medicament used to treat infections of the bladder, vaginal and less often in the nose. Thin soft rubber tubes used for irrigation solutions administration as catheter, bladder. You can see this is the nose. So the gels. Jellies are transparent or translucent non-greasy semi-solid preparations mainly used externally. It consists of dispersion of small or large molecules in the aqueous liquid vehicle rendered jelly by the addition of gelling agent. Example like hair gels. Next are the liniments. Liniments are the heterogeneous group of preparations that can be solution, suspension or emulsion type of intended for application to the skin. These are rubbed of affected area of skin for their counter irritant or stimulating effect, but some are applied on warm dressing or with a brush of analgesic and soothing effect. They should not be applied to the broken skin. You can see these are the liniments. Next are the lotions. These are the liquid preparations for the external application without friction to provide soothing or antiseptic effect. They usually contain alcohol and glycerin because alcohol drying and produces cooling sensation, whereas glycerin keeps the skin moisture for sufficient long time. Example like Vaseline, Nivea. Next are the lozenges, crotches. They are solid dosage forms consisting mainly of the sugar and gum. The gum gives hardness and cohesiveness and ensuring slow release medicament. They are used to medicate the mouth and throat and for slow administration of the indigestion and cough remedies. Example like strepsils. Next are the mixtures. These are the most common form of liquid oral preparations, usually with the aqueous vehicle, and the medicaments may be solution or suspension. This may be homogeneous or heterogeneous. Next are the mouthwashes. These are the similar to gargles but are used for oral hygiene and to treat infections of the mouth. These are aqueous solutions for rinsing, deodorizing, refreshing and antiseptic action. They are generally used after dilution with warm and mucous membrane of the mouth. Example, Oral-B mouthwash. Next are the nasal drops. Nasal drops are the solution of the drugs that are installed into the nose with a dropper. They are usually aqueous because oily drops inhibit the movement of cilia in the nasal mucosa and may cause lipoidal pneumonia in the long term. It is used for the vasoconstrictor, antiseptic or analgesic effect. Next are the ointments. These are the semi-solid greasy preparations for the external use to skin or mucous membrane. They are used for the protective action to the skin. Example like iodine ointment. Next are the ophthalmic ointments. Sterile ointments meant for the application to the eye are known as ophthalmic ointments. Example, chloramphenicol eye ointment. Next are the paints. Paints are the liquid for application to the skin or mucosa, usually with a soft brush. Skin paints often have a volatile solvents and evaporates quickly to leave the skin to dry off medicament. Example like coal, tar pigment. You can see this. Next are the paste. These are the semi-solid preparation for the external application that contains high proportion of finely provided medicament. The base may be anhydrous or water soluble. It provides protective coating over applied surface. Next are the pessaries. These are the solid medicated dosage form which is inserted into the vagina where it melts and dissolves to release medication. Next are the powders. Powders may be defined as fine particles which are result of communication or granulation of the dry substance. A powder can be mixture of drugs which are uniformly mixed together and presented in the dry form. Powders are intended for internal and external usage. Next are the solutions. Solutions are the non-fizzy, clear, liquid preparation for internal and external use containing one or more active ingredients dissolved in the suitable vehicle. Solutions may be sterile or non-sterile. Example, antitussives, Dettol, Lysol. Next are the suspension. These are biphasic liquid preparation for the oral use containing one or more active ingredients suspended in the suitable vehicle. It may show a sediment which is really dispersed or shaking to give a uniform suspension. Example, chloramphenicol suspension. You can see these are the syrups. Syrups are aqueous concentrated sucrose solutions with or without medicament. Organoleptic agents are added in the syrups. This may be simple, medicated, flavored syrup. Sprays. Sprays are the preparation of drugs in the aqueous, alcoholic, glycerin containing media. They are applied to the mucosa of nose or throat with an atomizer or nebulizer. Example, nasal spray. These are. Next are the suppositories. Are semi-solid dosage forms that contains solid medicated cone shape instead into the rectum, vagina, urethra. Body temperature, it releases drugs after melting for local or systemic action. Next are the spirits. Spirits are alcoholic or hydroalcoholic solutions of volatile substance. Most are used are flavoring agents, but a few have medical values. Next are the tinctures. Tinctures are the alcoholic preparations containing the active principles of vegetable drugs. These are relatively weak compared with the extracts. Example, benzoin tincture, tincture of opium. Thank you.